Most appropriate initial treatment for this patient's lung cancer. 65-year-old woman, history of smoking, PCP with cough, shortness of breath, and weight loss. Checks at X-ray reveals a 4-centimeter mass in the left lower lobe of the lung. A subsequent CT-guided biopsy is consistent with small cell carcinoma. PET scan shows mediastinal lymph node involvement, but no distant metastases, which is the most initial treatment for this patient's lung cancer. Okay. So I think if we have a 4-centimeter mass that's pretty significant in the left lower lobe, I would want to get rid of that. So question is, do we get rid of it first and then do stuff, or do like radiation and then, oh, it's small cell. Do I think about? Okay, I think we would start with surgical resection. She has no metastases, but it does have maybe involvement. Okay, so I would get it down to C and D. And I might just say radiation therapy, but I'm kind of unsure here. So,
All right, so it's kind of interesting, right? Because once again, this is probably a little bit difficult for step two, right? I think that you're working through it correctly, right? So key things when you're dealing with cancer is how big is the primary, right? So it's 4 centimeters, right? When I mean primary is like the tumor size, right? And then also
yeah.
has a spread, right? So when you're thinking about cancer in general, you're thinking about the T, N, and M stage, right? So T is for tumor, right? And so the tumor is 4 centimeters. N is for nodal, right? And so there is some mediastinal nodes. So there's regional spread, right? And then M is like distal metastasis, which they say they don't have. So you know that at least, it's kind of contained in a local area.
Yeah.
And then depending on the pathology, right? Like I said, this might be a little bit difficult for step two, I would say, because this gets really into, you know, very deep into, cardiothoracic, general surgery kind of ordeal, right?
No,
But
this
small
is
cell lung
good.
cancers, um, standard treatment limited of small cell lung cancer is concurrent chemotherapy and radiation should improve survival compared to chemo alone. Surgical resection is not standard as this type of cancer is more responsive to chemo and radiation. And kind of to keep it in mind, I'm not an expert of what's the surgical management of lung cancer by any means, right? But in my mind, right, if I were to connect it to step one kind of ordeal, if you remember small cell lung cancer,
Yeah.
um, the way it looks under the microscope, it looks very similar to what? Do you remember?
Um, it looks like it kind of reminds me of like U-wings. It's got like the blue.
Yeah. Yeah, very blue. Exactly. It's in that kind of same not only Ewings, but like leukemias, lymphomas, right? Which is like a very blue round circle, right? With a lot of nucleus, right? And so the reason why I'm mentioning this is if you remember leukemias and lymphomas, they respond very, very well to chemo. And so in my mind, chemo would be a very big thing here, right? Because the cell type is, they're neuroendocrine and cell line, right? And so I know this is a
Okay.
very far stretch,
Yeah.
right? But like I said, I'm not an expert on surgical or actually the management of lung cancers, but this is how I remember this, right? It responds very well to chemo because that's what it looks like under the microscope, and it's from the neuroendocrine cell line, and then radiation always helps with cancer. So, and just on a broader note, cancer in the body, you have three guns to do anything with cancer. Actually, there's kind of a fourth gun, but let's just keep it to three, which is chemotherapy, radiation, and surgery. Those are your three things that you can use for cancer. The reason why I said there's kind of a fourth is we lumped immunotherapy into chemotherapy, but immunotherapy is, on the rise too. So, that's actually kind of a fourth gun. But right now, your main three guns are chemo, radiation, in surgery. And depending on the cancer and the location, and what I mean by cancer is like the histology of it, you do different things, right? So for instance, head and neck cancer, a lot of head and neck cancer, you'll do surgery first, followed by, adjuvant radiation, right? Um, that's usually for head and neck cancer, right? I know a lot about that because that's in my field, but other cancers, is very specific towards that body type and also the pathology of it.